7 heart attack symptoms. Every 40 seconds, someone dies from a heart attack, but 80% of them could have been saved if they knew these 7 symptoms. Today, I'll show you in 3D animation what happens inside your body minutes before your heart stops. This could save your life or the life of someone you love. Let's start with heart attack symptoms in men. The first and most common sign is sharp chest pain that lasts more than 5 minutes. This pain occurs when coronary arteries become blocked and blood stops flowing to the heart muscle, the myocardium. The second symptom is pain that radiates to the left arm, shoulder, neck, or jaw. This happens because the nerve endings of the heart are connected to these areas. The third sign is sudden shortness of breath and difficulty breathing. When the heart doesn't get enough oxygen, the lungs work harder trying to compensate for the deficiency. The fourth symptom is cold sweat and pale skin. This is your body's protective response to acute myocardial ischemia. Your body redirects blood to vital organs. The fifth sign is nausea and vomiting. Many men ignore this symptom, thinking it's a stomach problem, but it can be a sign of myocardial infarction. The sixth symptom is sudden weakness and dizziness. When blood pressure drops due to a heart attack, the brain receives less oxygen. And the seventh is a feeling of impending death and panic attack. This isn't just a psychological symptom, it's your body's reaction to a critical condition. Now about heart attack symptoms in women, and here everything is much more complicated. Women often experience atypical symptoms that are easily confused with other diseases. The first sign in women is not sharp chest pain, but discomfort, pressure, or burning in the chest area. Many women describe this as an elephant sitting on the chest. The second symptom is unusual fatigue that appears days or even weeks before a heart attack. This happens because the heart works under increased load due to narrowing coronary arteries. The third sign is pain in the upper back between the shoulder blades. This is one of the most ignored symptoms that women often attribute to muscle tension. The fourth symptom is pain in the jaw, teeth, or throat. Research shows that 30% of women with myocardial infarction experience exactly this symptom. The fifth sign is nausea, vomiting, and stomach upset. Women often mistake this for food poisoning or gastritis. The sixth symptom is dizziness and near fainting state. When the heart cannot pump blood effectively, pressure drops. And the seventh is shortness of breath without physical exertion. If you're gasping for air just climbing stairs or lying in bed, this is a warning signal. Stop. Before we continue, do 3 important things right now. First, subscribe to the channel and hit the bell so you don't miss the video about how to restore your heart after an attack. Second, write in the comments, have you or your loved ones experienced a heart attack? What symptoms came first? Your story could save someone's life. And third, send this video to your parents, friends over 40, or those with risk factors, diabetes, hypertension, high cholesterol. This material could be useful and save a life. Let's continue. Now about heart attack symptoms in people with diabetes. This is a special risk group. Diabetic neuropathy damages nerve endings, so diabetics often don't feel the classic chest pain. This is called a silent heart attack. The first sign in diabetics is sudden, unexplained fatigue and weakness. High glucose levels damage blood vessels, including coronary arteries, which increases the risk of coronary artery disease. The second symptom is shortness of breath without physical exertion. If you're diabetic and suddenly start gasping while sitting on the couch, this could be a sign of acute coronary syndrome. The third sign is a sharp drop in blood sugar levels without apparent reason. When the heart doesn't work effectively, glucose metabolism is disrupted. The fourth symptom is cold, clammy sweat and pallor. For diabetics, this may be the only noticeable sign of a heart attack. The fifth sign is nausea, vomiting, and stomach upset. Many diabetics mistake this for food poisoning or gastritis and lose precious time. The sixth symptom is dizziness and near fainting state. When the heart cannot pump blood effectively, pressure drops. And the seventh is shortness of breath without physical exertion. If you're gasping for air just climbing stairs or lying in bed, this is a warning signal. And most importantly, how to survive a heart attack if you're alone. This knowledge can save your life in a critical situation. Step 1. Immediately call emergency services. Dial 911 or your local emergency number. Don't wait for symptoms to pass on their own. Every minute is critical for heart muscle survival. Step 2. Take aspirin. Chew 300 milligrams of aspirin. This thins the blood and can prevent further blockage of coronary arteries. but only if you're not allergic to aspirin. Step 3. Sit or lie in a comfortable position. Don't lie completely flat. This increases the load on the heart. It's better to sit, leaning on pillows at a 45-degree angle. Step 4. Open the door or window. If you lose consciousness, it'll be easier for medics to reach you. This can save critical minutes. Step 5. Breathe deeply. Slow, deep breaths help deliver more oxygen to the heart and reduce panic. Inhale for 4 counts, exhale for 6. Step 6. Do not cough hard. The old myth about cough CPR is not supported by research and can be dangerous. The American Heart Association does not recommend this method. Step 7. Stay connected. If possible, call a loved one and inform them of the situation. Keep your phone nearby so you can hear when the ambulance arrives. Remember, the time from symptom onset to medical help directly affects survival. The gold standard is getting help within the first hour after symptoms begin. This is called the golden hour in cardiology. You've just learned the 7 critical symptoms of heart attack in men, women, and diabetics, plus how to survive alone. Share this video with everyone you care about. It could save a life. Subscribe for more 3D medical animations that explain complex health topics simply. Your heart will thank you. See you in the next video.